For 38 years, Jennifer Heuertz has been a nurse. For the last 5, she's been dedicated to improving processes and procedures when it comes to sepsis.
Things can change very, very quick when it comes to identifying sepsis. A patient within a very short time can go from being stable, identified as being septic, within a short time can worsen and go into severe sepsis or actually even septic shock.
Jennifer helped develop a new protocol to help with early identification.
We started the process in the ED and really looking at screening tools for sepsis. In the ED, patients are screened on arrival by the nurse.
Little did she know the tables would soon turn.
I had significant fever, chills. I was having some urinary symptoms, some burning and frequency and such, thinking, I wonder if I have a urinary tract infection. I went to Sunnybrook Urgent Care and did some testing, and she had a urinary tract infection, and she felt a kidney infection, and so started me on antibiotics.
Jennifer's daughter, also a nurse, was visiting from out of town.
Mom was just off. Normally she's kind of bubbly and always wanting to do stuff, and she was just saying how she was tired and didn't feel good.
After she left, she was worried her mom's health was headed downhill.
I'd asked my sister how she's doing. She sent me a picture of her sitting in the bathroom, and she was kind of hunched over, just looked terrible. She was pale. So I FaceTimed them at that time, and I was talking to my mom, and she just didn't make sense. I told her she had 3 options. Either she lets my sister Stephanie take her to the emergency room, I will drive to Lamar's and take her to the emergency room, or I'll call 911, because I was pretty concerned that she was septic at this point.
When Jennifer arrived at the hospital, she told them she thought she was septic.
Just that word sepsis, there was just a hubbub of activity. 2 nurses came in, I had IVs, I had blood work, lab was there right away. My physician was actually notified, and they initiated the process per our protocols that we have in place.
Jennifer's sepsis was caught early thanks to the processes she helped create.
She said she didn't remember having that conversation with me that night in the bathroom, doesn't remember the trip to the hospital, so it's pretty scary that even somebody who sees sepsis every day can still not realize that they're sick.
And her daughter says she's grateful her training as a nurse kicked in that night.
Being able to recognize the signs and symptoms helped and benefited, because I'm not sure my mom would have woken up the next day if we hadn't gotten her to the emergency room.
Jennifer is now fully recovered and continuing to help mold the ever-changing processes and procedures when it comes to septic patients. Now she just has a more personal story to share.
I really appreciate the process and the engagement of the ER staff and their leadership in the ER into improving outcomes for all of us, including myself.